John SCHAEFER was born into the ski industry. He and his family own Berkshire East and Catamount ski areas, both in western Massachusetts. On March 28th, an email appeared in SCHAEFER's inbox. This simple moment, he says, initiated a series of actions that galvanized the ski and action sports world into a focused global effort to bring protective eyewear to healthcare workers who are now fighting the war against the coronavirus. Producer Dave Fraser brings us the story.
A ski season that in some regions would normally extend into April and even May was cut short this year by the measures to counteract the spread of COVID-19.
We sort of saw the writing on the wall with where our industry and sports venues and government was going, so we shut down on March 12th, which was about 3 or 4 days ahead of the rest of the ski world.
John SCHAEFER owns both Berkshire East and Catamount ski areas, where a few remnants of snow still dot the slopes. Soon after closing, SCHAEFER, whose wife is a physician's assistant at Berkshire Medical Center in Pittsfield, recognized that there was a need for face protection for healthcare workers.
I had been looking at mask making machines to set up our own production lines and was really researching that in the days following our closure. And then I got an email about 2.5 weeks ago, almost 3 weeks ago now. And it was from a doctor in New York City just looking for ski goggles. And I was like, aha, we can do that.
SCHAEFER responded to the doctor's email, putting the wheels in motion in an effort to let the ski industry help out the medical industry.
We set up a simple spreadsheet that we could share. He could share it on his end through the hospitals, and I could share it on my end through the inventory supply side. And we sent it out one Saturday night. I woke up Sunday morning and my email messages, everything had blown up, and there was a huge amount of interest. That afternoon, we built a website and named it Goggles for Docs, and Goggles for Docs was born.
The way it works is people with new or used goggles, usually that's a skier, snowboarder, or even a motocross rider, logs onto the Goggles for Docs website. There they can find a list of hospitals in need of protective eye equipment. They get instructions on how to clean and package the goggles for shipment, and they can even find a list of nearby drop-off locations.
By the end of the week, we'd ship 9,000 goggles to facilities in all 50 states, 5 countries, and had 277 drop-off locations manned by volunteers across the country.
Volunteers like Emily Shaw from Great Barrington, whose kids are on the race team at Catamount ski area.
As a skier and as somebody who we ski our way through the winter, it just completely resonated and just felt in a beautiful way like such an easy thing to do to make such a big impact.
That impact was felt at St. Francis Hospital in Hartford. Like most healthcare facilities, they were in desperate need of protective eyewear.
The protective eyewear, the shields, PPE in general was pretty hard to come by and very desperately sought after at many, many places.
About 2 weeks ago, St. Francis received a donation of 150 goggles from Goggles for Docs.
People are so appreciative that somebody that has no idea who they are or where they are or what they do is looking out for their well-being and is doing everything they can to protect their well-being while they're doing everything they can to protect somebody else's well-being and caring for the sickest of the sick.
Since its origination less than a month ago, Goggles for Docs has grown into a global effort providing new or used ski goggles to healthcare workers. To date, over 35,000 goggles have been donated to healthcare facilities around the world.
People are just all over this. They're doing everything they can to help, to participate. The whole industry is rallied around getting the protective eyewear to the people who need it the most.